Well, it's Tuesday, which means we're talking health this morning with Greenwood Leflore Hospital. This morning, we're joined with Dr. Jeff Harden and Miss L.B. Wiggins, who is with the Emergency Care Department over at Greenwood Leflore Hospital. Good morning, guys.
Morning.
How are y'all doing?
Good.
Good.
We're so thankful you guys are here with us. May is National Stroke Awareness Month, so we've been talking about strokes and the dangers and the seriousness. But to kind of do a recap, Dr. Harden, can you tell me, let's talk about stroke a little bit. When somebody has a stroke, what are some of the signs and symptoms that somebody may be having before they have a stroke?
Well, those can be varied, but three things we usually like to focus in on are, do they have any weakness or numbness in their face? Do they have any weakness or numbness in their arms or legs? Or is there a problem with their speech? Is their speech confused? Do they have slurred speech, or is it garbled, or can they not speak at all?
And these are, these are things that are really kind of apparent. It's not something that you may or may not have. I mean, something like that it's pretty clear, right?
Most of the time, yes. Sometimes there are some subtlenesses there. Every case varies from case to case, but usually they're pretty obvious.
And if somebody feels like they are having a stroke, what do they need to do?
They need to call 911. It's better to call and let the ambulance get there and let them bring you to the hospital for a variety of reasons. Number one, they can assess you at the scene. They can notify us so that we're prepared for your arrival, and therefore we can have everything in place so that we can treat you on a more rapid basis and have everybody ready to go before you arrive.
You know, and that kind of takes me right into the follow-up. LB, you know, if somebody is having a stroke and they call 911 and maybe they get the emergency room, what do they need to tell people?
The first thing you need to do is make sure you know, or the family knows, your own set of symptoms. The last time they saw the patient normal. That gives us a time frame to where we can work to get the best possible outcome for the patient. The next step would be, if they come through the front door, notify security, tell them, they think they're having a stroke. We'll come out, do a quick assessment, get you straight to the back. As far as health history, that would be the next thing. Allergies, and make sure when you come, bring your medications. That's a really big thing. We need to know what type of medications you're on, and that helps us forego our treatment as far as the next steps post.
When somebody does, let me ask this, when somebody does come into the emergency room at Greenwood Leflore, what is y'all's process for taking care of that stroke patient?
Usually we call what we call a stroke alert. That lets us get the quickest time to get the scans and everything we need to further evaluate the patient. The first thing we do is, a basic evaluation, seeing what type of weakness, if it's both sides, one side, the onset of symptoms, some basic history. We try to get a CT scan as quick as we can, and then that lets us know what treatment role to take from there. It's important for the family to be with the patient, because a lot of times the patient may be confused or altered, and that helps us get more of a background information as well on the patient.
So it really becomes a team effort.
Right, right.
And all of it goes back to what you were saying, Dr. Harden, is just, it's time. Be there quick and respond quickly, so that's really special. Let me ask this, Dr. Harden, if people want more information, they want to find out more maybe about what Greenwood Leflore has to offer, or even more about stroke, what should they do?
They can go to our website, glh.org, or call the hospital, 662-459-7000.
Fantastic. Thank you guys for being here this morning, just to inform us and make sure we're all staying healthy, because that is a big thing. We want to stay healthy, and this is an important issue. We also want to know, with Greenwood Leflore, May 25th, National Stroke Awareness Day, Greenwood Leflore Hospital will be doing an all-day segment where you can go in and ask some doctors, like Dr. Harden here and Ms. LB, questions that are specific to strokes or whatever it is that's on your mind that you'd like to talk to. Again, that's May 25th. It happens at Greenwood Leflore in the 1AC building, conference room. Is that right?
That's right.
Fantastic. Thank you guys for being here this morning.
Thank you.
Stay with us. We've got more coming up after the break. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.